At American Trends, we only talk about what your social media says is trending, so let's get right back to it. Now, we hear a lot of data on what diets work and which ones don't, but there's a new study that says high-fat diets are superior to low-fat diets. Here to discuss that study and some other trending medical stories today is the chairman of medicine and vice president of Newark Beth Israel Medical Center, Dr. Bob Lahita. Dr. Lahita, welcome to American Trends. Good to have you.
Hi, Gina. Good to see you.
Doctor, a study of over 7,000 dieters has found that the Mediterranean diet, which is a higher fat diet, is more effective than a low fat diet. People lose more weight when they eat more fat. Right. So I am so tired of this. You know, you remember in the was it the 90s or so, like salt was bad, now salt's good. And then we heard forever that what was the second thing that was so bad? I guess it was fat, and now fat's supposed to be good. How do you know what to believe?
Well, there are different kinds of fats, and you have to understand that there's special vegetable fats, there's nuts, and there's all kinds of other substances that are present in these Mediterranean diets. And these are absolutely wonderful. Remember, the real source of fat is carbohydrate. So carbohydrate, which is limited, does not result in a lot of weight gain. But the Mediterranean diet has always been successful because of the nature and the kind of fat for heart disease as a preventive and for diabetes as a preventive, so that the Mediterranean diet is really a good thing. And despite the fact that it has a lot of certain kinds of vegetable fats and nut fats, it's still very healthy for you.
All right, well, speaking of diets, obesity rates in the U.S. are rising for women, but not for men. This new research says that women are getting fatter and fatter and fatter. Men, they've kind of stabilized. They're kind of staying the same. What do you attribute this to?
That's a good question. That may well be related to the estrogens and the androgens. You know, the men tend to lose weight a lot faster than women. I think women, because of their estrogenic nature, actually aromatase hormones. They change the character of hormones in fat. And I really can't tell you why men lose weight faster. It probably has to do with thyroid function, which is far more labile in women. But I don't have an answer for you there, Gina.
That's interesting, because I know so many people who are obese and yet they don't test with a low-functioning thyroid. And so do you think there are thyroid measures that we're just not onto yet?
Well, there's a lot of subclinical hypothyroidism. That's underactive thyroid. I see it in my practice all the time, where people have normal thyroid function, but yet they produce things called antibodies against their thyroid, and they produce a syndrome called thyroiditis, which is very subclinical. And they gain weight over time. And over time, it's like a rolling stone gathering moss. And the weight goes on. So they really have to see an endocrinologist to have themselves further evaluated.
Interesting. Would that be what also is attributable to the whole Biggest Loser information that came out sometime last month? We talked about it here on the show, where it showed that these people who came off of the Biggest Loser and had lost all this weight, gained it all back, and now could only maintain on something insane like 500 to 700 calories?
Yes, that's been a theory that's been proven in animals over the years, that certain cells, fat cells, persist in the body. So you can starve down to a very low weight, but if your body has been programmed to have these fat cells present, they will simply regain function as you go on, and you will gain the weight back. I've seen that with numerous patients of mine. I've seen it with friends of mine who have lost upwards of 50, 60, 70 pounds, and then over a period of 1 to 2 years gain it back.
That's fascinating. Sure hope we can come up with some answers for those people. All right, a study on ADHD drugs found that the standard drugs used to treat ADHD may cause an abnormal heartbeat, and that was trending today. Are we talking about drugs like Ritalin and Adderall that may cause these problems? Vyvanse is another one. I know a lot of people on these medications, and honestly, as someone with ADHD, I've tried them. I don't have great luck with them, but if they're causing heart problems, maybe that's not such a bad thing.
It's not such a good thing, because there are many, many behavioral drugs and other drugs that affect the way the heart conducts electricity. We look, for example, at the electrocardiogram, in many patients that come into the emergency room, we look for something called a QT interval, which can be prolonged with certain drug ingestion. That QT interval, when it's prolonged, induces irregularities of the heartbeat. We call that arrhythmias. We see that a lot. And a lot of people on drugs like Haldol and Thorazine and some of the other antipsychotics demonstrate this prolonged QT interval. And this is really the reason why young people may have an arrhythmia or irregular heartbeat when they're taking these kinds of drugs.
Oh, interesting. So the uptick we've seen in like maybe on the basketball court deaths or sudden deaths. I even have a friend I have a couple of friends actually who've just lost children completely out of the blue with this this thing you're talking about. It may be because of some of the, possibly you're saying some of the drugs that they're on.
Absolutely, no question. We've seen it over and over again.
Interesting. All right, another study on opioid painkillers found that taking them for periods of time actually worsens chronic pain and causes you to need more. Sounds like it works out well for the drug companies, but what about the patients?
Well, that's a very easy problem. That's a problem of tolerance. Now, you know that somebody who's a drug addict, and believe me, I have patients in the ghetto that take 5-6 bags of heroin a day. It's fairly cheap, about $5 a bag. They will continue to increase their heroin intake over time, so they gradually need more and more and more. Some number of opiates that would kill either you or me can be easily tolerated by somebody who's conditioned. Their cell receptors are increased, they're in the brain. Their addiction it goes without saying, gets worse and worse, so that they need more and more opiates to make them happy. In other words, one bag doesn't do it, maybe 20 bags will do it, and eventually you get to the point where you're really overdosing.
Do some people have just an increased tolerance speed? Because I've noticed for me, just when I've had a surgery or something and I have to take some painkillers, that my tolerance is, I mean, I'm just totally getting nothing from them after maybe a day or two. So I just stop. Yes,
you definitely achieve a tolerance to any kind of opiate and painkiller as you go forward. The more you use, the more you need.
Wow. All right, there's a new medical breakthrough using stem cells to reverse brain damage after a stroke. We've been hearing about this for about over a decade, how stem cells were going to change medicine. This looks like a really great example of that. Something to be excited about, Doctor?
Yes, it's very, very exciting. We have always known that stem cells can regenerate muscle, liver, the GI tract, for example. Probably the biggest area of regeneration in the body is your mouth and your intestinal tract. You can remember that you can get a sore in your mouth, which heals very, very quickly. Within hours, you can have an aphthous ulcer in the mouth go away. Those are cells that really produce or can turn over very rapidly. A stem cell has what is called pluripotent activity, which means it can become anything, including nerve cells. We've always wondered why cells in certain animals like lizards...
I'm sorry, Doctor. That's such exciting stuff, and we're out of time. I want to have you back soon, though. Thank you so much for all of your wisdom tonight. We'll be back in a moment with more America Trends.